Hello, I'm Dr. Amar Chauhan, and recently I was reading a book that is Moonwalk with Einstein. That's by Josh Foer. So I was just talking to my staff that how to remember his name. So Josh, like we understand what is Josh, and Foer. So that is four. So you try to connect things. So then I thought, why not to by building memory palaces, like which is originally described by a person, I think his name is Synodines, something like that. So we thought, why not to build memory palaces for our skill. So today we will be building memory palaces for intubation. Now what this work basically, what that the way I see, like we are entering into the room. So we will imagine in our memory palace that we are entering into the room, and this is bed number 1. So let's see what are the various things which are required for intubation on bed number 1. So these are gloves and these are various medication. But important thing is that post dose epi. Okay. Then NPA, OPA, Ryan's tube. Then this is what I want to show you, the PEEP valve. Okay, we'll show you how it works and the embo unit. So let's take a photograph memory in the brain that these are the things, and now we will imagine that we came inside. There is a bed number 1 and there are things lying on there which are required which are needed rather in intubation. Now let's move to the second, bed number 2. Now they are monitor, ECG, electrode, pulse oxy, ETCO2. But more than that, what we have is a patient, laryngoscope, ET tube, boozy, and this is again I would say very important, portable ETCO2, securing ET tube, rescue device, and then bronch unit, and of course nasal probe. So now we will take the photograph of this bed number 2 in our brain. So now we know that these are the things lying on bed number 2, and this is how this PEEP valve is attached. We will show you how to attach the PEEP valve. So these are the things which are generally, then we will show you how to do intubation, RSI or DSI, basic things, international standard. Okay, now if we fail in intubation, of course there is a ventilator. Then if we fail in intubation, if it is a failed intubation, then this is a surgical kite drum, and these are like boozy, this tracheostomy tube, ET tube. Sometimes you can put ET tube number 6, scalpel, and this is a kite set with Seldinger technique. So now on bed number 3, if we imagine that there were things for surgical kite. Now let's take that photograph in our mind or in our muscle memory of the brain. Now there is something I want to show, don't hurry up, that we have designed, because I keep doing things, sometimes successful or not, for intubation. Now just we have a monitor. So what we need basically, we have to have the mastoid and the sternal node in the same plane. So this is around the same plane. So this is what we have designed, and this is very useful for us. Okay, so we'll show you how to intubate using this support. Of course there are other supports also, but we found it very helpful. Now coming to intubation. Now we can have that memory also that there was some intubation support. Okay, now suppose the patient comes. Okay, so first saturation are down and there is an indication for intubation. So what we need to do, start BVM. So always, I'm stressing again, always 2 hand seal. 1 hand seal will not work. So this is what I want to demonstrate, and then jaw thrust, and then so this is PEEP valve basically. It recruit extra alveoli. So this is very important when we are doing BVM for intubation. You must use PEEP valve. You can do up to 20, PEEP of 20, and with nasal prong. So this become kind of CPAP system. So always keep nasal prong, oxygen approximately 15 liter. Start again. And then one important thing I want to again tell you that whenever you do BVM, must put the OPA. Do these things, you will find the difference. Okay, so you can put that way. So we will do without so they are doing BVM without 12. Try to practice 12 only.
Okay, sir.
Counter rate, okay? Because we are not conscious when we are doing BVM. So now do. So now there's some problem with that. Now we will apply PEEP. Now you see there's something wrong with this. So with PEEP, definitely you will recruiting more alveoli and oxygen will be much better. So these things I wanted to tell you. Number one, whenever you do BVM, put an OPA, attach a PEEP valve and nasal oxygen. यहाँ लगाओ apneic oxygen. Okay, अच्छी तरह लगा के दिखाओ. So these are the things which we miss in emergency. Okay, then hold on. Then the important thing is, which I forgot, resuscitate before you intubate. This is very important. It's not like BP of 80 and you are going to intubate. The patient will crash. Okay, they will arrest. So this is very important, and the important thing I want to say, push dose epi. Please keep that, and no adrenaline drip if patient is hypotensive. So must resuscitate before you intubate. You must have all the parameters, physiological, of course, anatomical will be difficult. You must anticipate anatomical difficult airway, but physiologically you try to bring the physiology as near as possible. Okay. So if oxygen is not there, then we will try different positioning. Okay. Then PEEP valve, and then for hypotension we will give fluid. We might give press this push dose epi, and then of course bleeding, then blood. So these are things we need to take care when we are doing BVM. We are doing intubation, push dose epi, fluid, blood, restore the volume, and then of course the PEEP valve, OPA and nasal flow. This nasal oxygen approximately 50 liter has to be there whenever you intubate. This is very important, and sometimes we forget. That's why we thought like let's do a video so that we can remember. Now we will find out from Rinki how many photographs she remember, how many things she remember in those 4 photographs. Okay, so take care, huh?
Yes.
And thank you for watching this video.